Good morning and welcome to this Lethbridge Emergency Advisory Committee meeting. We'll start off with the acknowledgement statement. The City of Lethbridge acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. The City of Lethbridge is also home to the Métis Nation of Alberta, Region 3. So, first off, I'd like to start off with a roll call, Madam City Clerk.
Thank you, Mayor Higgin. Councillor Campbell.
Present.
Councillor Carlson. Present. Councillor Middleton Hope.
Present.
Councillor Palladino.
Present.
Councillor Parker.
Present.
Councillor Schmidt-Rempel. Present. Acting Mayor Dodick.
Present.
Deputy Mayor Croson.
Here.
And Mayor Higgin.
Present.
And Mayor Higgin, I just want to announce that we are live streaming this meeting. It's on the web. We don't usually do it as per the procedure bylaw but it is a special COVID meeting and we did get requests, just so everybody knows. Thank you.
Thank you. Next, we'll have the confirmation of the agenda. So I don't know if anyone has a chance to look through the agenda, if there's any questions on the agenda. Seeing none, can I have someone put a motion to approve? Councillor Schmidt-Rempel, all in favor? So carries. Thank you. Also, we have the minutes of the September 27th. It seems like forever ago. So, the 27th meeting that were attached to the package. Is there any questions on that? Any changes? If not, can I have a motion to accept? By Councillor Campbell, all in favor? So carries. Next, we'll move right into the public reports. Mr. City Manager with a verbal update.
Thanks, Your Worship. I'll just a very brief introduction. We'll proceed in two parts today. We'll start with Mr. Palmer, who will provide Council with a general overview and update, and then we'll move to Mr. Fox, who will provide Council with a corporate update. And just before we do that, it's been a while since Council's met in this committee forum. Just a reminder that at present we're following and adhering to all provincial health protocols. We've been managing from a corporate perspective with an eye to staff and citizen public safety from the beginning, a number of protocols that we continue to manage. So this fifth wave, this Omicron wave, isn't new in the sense that we've had to adjust and adapt as this has transpired over the last 2 years. But again, each situation's been a little bit unique, so we'll explain today some of the things we're doing in anticipation of what we're seeing occur in other jurisdictions. So, and the last thing is, if Council has questions related to, because this is in public, we're going to endeavor to keep some of the information at a general level, specifically when it comes to human resource issues. But if Council wants further information, we can go in to camera if that's the desire and share more information.
And the questions, did you want the questions to come out throughout the presentation, or you prefer to finish speaking if there's any questions? Or
I think at any time would be fine.
Right.
And the last thing I would say is that you'll see in both Mr. Palmer's and Mr. Fox's statements that our real focus now is on business continuity and making sure that the provision of services is maintained and that we're able to communicate to the public in a timely manner any changes to service provision as we go through this next number of weeks. So I'll, without further ado, turn it over to Mr. Palmer.
Afternoon, everybody. So from a COVID perspective, as the City Manager has mentioned, it's more of a transition to business continuity and the continuation of services at this point. At the same time, we're also adequately observing what continuity of government would look like for yourselves and making sure that we're prepared in any state to take care of that. And Mr. Fox will certainly go into more details when we talk about business continuity. From a general perspective of Alberta Health, as well as the City Emergency Management Team, as mentioned, we're transitioning into business continuity, understanding that Alberta Health is the primary entity that's in charge of the public health priorities. They will download those to us. We are still meeting weekly with Dr. Hinshaw, and we have full access to the public health office here in the South Zone where we can forward any questions that you might have here today or anything else that might come forward. Omicron variant continues to spread quite rapidly. The province has been gradually sharing the data that's coming out there and the testing data that is there is present. The one thing that we currently don't have is confirmed modeling for the long-term impacts of what this wave will look like. So for the most part, the information what we do have is on the assumption of what Alberta Health is forecasting. The predominant model that's coming out, and it's being backed by the other researchers as we're all experiencing this globally, is a rapid spike followed by a rapid decrease, which we're hoping maintains. But obviously, knowing that COVID is ever changing, we can't assume that that is going to be the default scenario. But we are working around that to see what a quick wave, if we want to call it that, would look like in terms of impacting our services, as well as the health sector side of things when we're looking at hospitalizations in ICU. On the note of hospitalizations in ICU, if you've been paying attention to the updates that have been ongoing the last couple of weeks, they have remained quite steady at this point, and being managed by Alberta Health at a fairly good rate at this point. We continue to support them however we can, in terms of either sharing information or into the community or just internal processes to assist with risk transmission. We do know that the vaccines are predominantly in the community now. We're over 80% in the city itself. But again, vaccine is not a silver bullet approach. It is not going to eliminate transmission. It's basically looking to decrease the severe outcome. So if we remember from our municipal elected officials course, we talked about the high frequency, low risk. That's kind of what they're forecasting with Omicron at this point. We're going to see a number of cases, but hopefully everything is on the less severe end of things. Obviously, that's the best case scenario, but we do continue to communicate with Alberta Health to see if that's going to change or if anything is differing in terms of the science from that point. For the most part, the public health measures remain the same when we're indoors here, and obviously exempt with the plastic barriers here that are in council, but masking is required in all indoor locations. Anyone that isn't part of the restrictions exemption program will be required to enforce mandatory distancing, as well as 1/3 capacity limits as well. There have been ongoing changes in terms of what we've seen in schools, a completely different sector, but we continue to make sure that we're getting that information and making sure that it's digestible to go out into the community as well. The isolation times have been a little bit of a point of clarity point here in the city, just because that directly influences our business continuity. When individuals are a confirmed case or a close contact, there are differing levels of days that we have to work through to bring them back in the workplace. So when Mr. Fox does get up here to talk about business continuity, that's kind of the context behind it. When we look at the vaccinated group only having 5 days versus the unvaccinated in the 10 days, we need to balance that risk and go through it with our contact tracers, and they continue to do amazing work in terms of coordinating with our managers and those staff that are impacted by the virus in this way. Again, I think the big impact here when we're looking at business continuity is the same messaging that has been throughout the pandemic, is stay home if you're not feeling well. And when we talk about a new normal state, that's likely the case that we have to look at. At some point in the workplace, there is going to be an acceptable level of risk, but at some point too, there's a personal onus that needs to be taken into account as well. And that's the messaging from Alberta Health that we continue to push out in the corporation to maintain that safe workforce, but also maintain our services in the face of this potential disruption. We are working, again, a lot on the assumptions through Alberta Health, but again, we continue to communicate with them to see if there is changes in the science or the data that is coming out. We eagerly anticipate some more, concrete modeling that might come out, whether it's federal or provincial. At this point, it's still the former from the fourth wave. We talk about rapid testing and what the province is doing. Over the holidays, rapid testing was available here in the city, but only at the public health office. Alberta Health is working with the Alberta Emergency Management Agency to make that more accessible across the province and include Lethbridge that would have not only public health but also pharmacies as well. Premier Kenney had mentioned that 10 million rapid test kits have been purchased, and we're waiting to hear on the dissemination of those. At this point, there still aren't many in the city. It's been tough to come by, and I know both the provincial and federal government have had challenges in that regard. So a lot of it boils down to procurement and the dissemination of these tests, but hopefully over the next couple months we see that supply chain balance out itself. And again, that will be a big piece for us to communicate with you when they do become available in the community, so we can let our residents know that rapid test kits are available, especially with the way PCR testing is. If you are a confirmed case, you're usually waiting a couple days to get into that confirmed case. So if we can start getting rapid tests into the community, it will certainly help with those PCR tests, which are currently being allocated to the high-risk populations and facilities. Again, recognizing that the province is well aware of the business continuity concerns that are currently ongoing. We're reaching out to other communities as well, just to see where the priorities lie, the issues that they're noticing, and again, that's mostly tied to workforce, but again, anything that might be associated with COVID as well. There are still ECCs activated across the South Zone here, and we continue to work with everybody on that, including the M9, which is the Greater Alberta Group of Emergency Managers. The impact itself, Dr. Henshaw states that we can expect about at least 30% of our workforce to be impacted by this. And again, it's that high frequency, low risk projection that they do have. We're gauging that that's probably quite accurate with the numbers that we're seeing in other provinces that are just a little bit ahead of us, but also some of the larger centers here. So again, taking into account, we might see 30% in each department, but we're going to be monitoring that and again, seeing what Alberta Health can provide us in terms of more concrete data. At this time, that was it from the emergency management and Alberta Health perspective. We're open for questions, and then we can segue nicely into that business continuity side of things with Mr. Fox.
Questions? Councillor Midland-Home, did you? Oh, sorry, I thought you. Right.
All right, well, thank you, Mayor and Council, for having me here today. Luke, you might as well stay up there because you may have more to add, where Luke is part of the COVID response team, and thank you very much for your update. I'll try not to overlap in anything that Luke said today. At the city, we've had a cross-departmental team relating to our contingency plans and monitoring COVID in the organization. And we've named it the COVID-19 response team. There are people from all across the organization involved in it, so we get all different perspectives and are able to bring good information to ELT and then to council. In that, we monitor the open cases in the city on a daily basis. Today we are sitting at 59 cases of open cases, and we monitor that by department continuously every day. So that's a live action thing that the COVID response team makes sure that we're updating. We also monitor any of the new press releases coming out, changes to rec facilities, or any of the changes from Alberta Health that may impact the workplace, and we schedule meetings and make recommendations to ELT accordingly. Currently, we are sitting around 90% of our employees are vaccinated. So that is 10% that are not or have chose not to disclose. A lot of those are following the rapid test protocol put in place by our policy. And we continue to only have 3 areas that are mandatory vaccination, which do not have the option for rapid testing. And that would be the NMAX, the airport, and fire EMS. And fire EMS, we continue to work with AHS, where they have changed their policy slightly to allow rapid testing in some locations. So we continue to work with AHS EMS on making sure that we're up to date on that, and if we are able to follow that protocol as well. Contingency plans in the department, we have had them ongoing throughout the pandemic, but at this point, with the rapid rise in cases and where we're expecting a 30% absenteeism from work, we are asking everybody to take a second look at them, go through them with a fine-tooth comb, and make sure that we get them all to the emergency management, updated and fresh to Luke in a timely manner. We also work with all of our partners, any of our fee-for-services, and make sure that they have plans in place. And also we manage with them, so if we know if there's going to be any closures coming up, that in a timely manner we can notify council and the public that there may be disruptions in services. So we do have plans in place that if we hit those numbers that we will notify the public and council. And I believe that that's all I have at this time. If there's any questions, I can take them.
You have questions. Councillor Middleton-Home.
Thank you, Your Worship. Mike, I've just got a question in regards to the NMAX Center, and you may be aware of this, but you may not be, so I'm just going to raise it, and perhaps you can respond to it. At the NMAX Center, people are not screened if they have a season ticket pass, and if I loan my season ticket pass to you, you can go into the NMAX Center using my season ticket pass, and there's no restrictions in terms of whether or not I'm vaccinated or not. So are you familiar, are you aware of this circumstance occurring at the NMAX Center?
I was aware of the season ticket holders showing their vaccination status, similar to other associations, and getting a sticker on their season pass, so then it shows that they're double vaxxed. I was not aware of the ability to transfer your season ticket to somebody else.
Right.
So I can look into that, and I can get back to you with more information.
Good, thanks very much. I just don't think currently there's a workaround solution for it. And it's something that just has arisen recently, and I think it's something that certainly should be looked at.
Just, if I could, just to confirm, with the season ticket, the little sticker that you get on there.
Yeah.
Now, you can't transfer electronically, but you can, as indicated, I think you had mentioned, Councillor Midland Hope, if the card was given to someone else, so that's your own, that's your person, this is if you're giving out your driver's license or anything else, I guess you would try to hold that, because if that is found to be the case, it's my understanding that not only would you have your season tickets canceled, but that's something to definitely look into. But that card, I know that you can't transfer your ticket to someone else if you've got that sticker, so that's the important part of that. But.
Yeah, and it is, that would be a criminal thing, so you would lose your season's ticket for sure.
Right.
Not sure what else, but I will look into that and get back to you.
Good, thanks, Mike.
Any further questions? I do have one, and I guess it's, we've asked this before, is there anything that council can do to help support, what's been going on? I mean, especially, we're looking at the possibility of it could be up to a 30% decrease. We plan for that and hope that it doesn't happen. Is there anything else that we can do?
From a community perspective, it's continuing to share the information that's coming out from Alberta Health, especially the stay home if you're not feeling well. Whether you're coming into work or going into a public space, that's the biggest ask that comes from Alberta Health, is that we continue to share that in the community. Internally, I guess it's just supporting the administration as we work through the continuity of operations, but as well, taking into account the continuity of governance. You're equally important to the city in terms of how we maintain the services as well. So making sure that we're taking care of yourselves as well and getting adequate planning there. But really, it's really advocating to the community and our staff that the messaging that's coming from Alberta Health is going to be the best way we get through this variant itself. Just knowing that we probably won't have data that shows us the impact on the healthcare system until late January. So until then, the best we can do is share a lot of information.
Thank you. And to Mr. City Manager, just to confirm, I mean, we definitely would not like to see a 30% decrease, but we do have a plan in place if this was to happen, because I know there's other communities that have it's affected transit and that, and so we are looking at that. Is that correct?
Yes, and we've had departmental. I've lost the business continuity plans since the outset, and they've been updated, modified as we've gone through this. So we're in the process of doing that again. The one thing I would just caution and share is, as Mr. Palmer's made clear, it's difficult to predict what this will look like. And as you said, we've seen other cities have challenges in areas like transit. We've seen other health systems impacted. So we really won't know what it looks like till it arrives. But we're doing our best to prepare for whatever contingencies might emerge.
Councillor Carlson.
Thank you, Mayor Higgin. Thank you for the updates, folks. Mr. Fox, Mr. Palmer, the business continuity plans, I am assuming they're going to be different from each business unit. The best case scenario, if the worst case happens, is that the 30% is spread out evenly across the organization. But if one business unit gets hit hard, and I'm thinking specifically sort of critical services, like water treatment, wastewater, et cetera, do we, you mentioned, I believe it was the M9, do we have agreements or amongst those that if we get hit hard in one area, and can we share resources? Is that being discussed at all to sort of backstop each other?
Definitely, and it's going to vary between the departments, and I mean, that assumption we also are putting down to the department level, especially when we have our frontline departments that are actually public-facing versus those that are really like the public ops side of things with their crews. So we know that there's an elevated level of risk between certain departments versus others, so we can't make it a consistent approach. But to answer the question, yeah, there are departments who have gone above and beyond the emergency management mutual aid agreements that we do have. So just as a refresher, we have the Southern Alberta Emergency Management Resource Sharing Agreement, which comprises 32 communities here in the south. And you can put whatever kind of request you need there. It's more so geared for emergency management, but if you need public ops workers that are at a certain level, we could certainly entertain that through that method as well. I can share that the 911 Center has created agreements specifically to them to say if our call center cannot even answer the phone, there is still somebody that's going to be able to answer the phone. So other departments have taken it upon themselves to find solutions, but we do have overall pieces that can assist with that.
Thank you. Thank you, Mayor.
I think Director Fox, did you want more to add to that?
Yeah, if I could, I just wanted to also add that each department is planning for the worst and hoping for the best. So again, we look out to make sure that we can keep our essential services running, and we have made a matrix up of what are deemed essential and then so on as we go down to make sure that we can transfer people in different positions if one is falling behind. So we are trying to work internally as best as possible before we reach out externally, but we would work out external as well at that. Another point I just wanted to make is that we are recommending to all staff to work from home if possible, and that will also continue to be with SPCs and coming up council meetings. We won't have a lot of staff presence. They'll be online and calling in the future.
Councillor Campbell.
Thank you. Thanks. Mr. Fox, just want to make sure I got it. Did you say that we have right now within the city is 59 active cases? Is that, did I misunderstand that?
So we have 59 active cases in the city employees.
City employees?
Yeah, not in the actual city.
Right.
My update was more on just the corporation.
The actual corporation, and I'm just wondering, is there a trend as to where those people are working? Is there one group that's affected more than others?
Yes, so the main focus of that is in transit and in police currently.
Right, and I don't know if this is a question you can ask is, are of those people, do we know how many are actually vaccinated, or is that something we don't look at?
Well, again, we do have those types of numbers, but on the overall, we have a 90% rate of employee vaccination.
Right, and I don't know if this is appropriate asking, but of those people that have COVID right now, are those severe cases, or are they just kind of minor cases?
Again, we wouldn't know that individually. That's the own personal health care.
And I probably shouldn't ask that, but just was wondering where we're at. Thank you.
Any further questions? Seeing none, thank you very much. It's been, as I said earlier here, September 27th of coming back to this meeting that we had, and I sure appreciate the update. I know the community is going to appreciate that, to just get the information and how that is. Questions are coming in, so thank you very much for that update. With that, we'll move to a motion to accept the COVID update report for information. Have a motion from. Okay, let me just look here. Oh, yeah. Joking. Councillor Palladino. All in favor? Any opposed? That so carries. Thank you. And now a motion to adjourn. Oh, I guess we don't have to do that anymore, do we? So we are now adjourned. Thank you.